Good morning.
Any observations out of the modelling or numbers we got over the weekend, or is it too soon to tell?
Well, the modelling that was released over the weekend, and also we've got some other modelling that's going to be available in the next couple of days, really paints a few scenarios. And the scenario that we're now looking at is, of course, what the impact of this level 4 precautions have on the number of hospitalisations and the potential number of deaths. And I guess that's where we're most interested, is to see what the impact is of the actions we're currently taking.
Got a trend or too early?
Well, we haven't got a trend at the moment in what the impact of the actions is on our current cases. We're expecting that to keep climbing for a bit, and we didn't feel that it would be before 10 days. So it will take at least 10 days before we're likely to see a decline.
And when you say likely to see a decline, what percentage chance of a decline given what we're going through?
Well, that's very dependent on the extent to which people comply with the request to self-isolate.
But if things go well?
If things go well, we should start to see after 10 days or so that the numbers of new cases each day decline. And obviously our aim is to get right down and effectively break that chain of transmission. And if you combine that with the border measures where we can control who's coming in and out, that should really put us in a good position with a very small number of cases.
What is that number you're looking for?
Well, ideally we'd like to get it down to zero, but haven't seen any country that's been able to do that. Even if you look at, say, China, with its very stringent measures, they haven't been able to get it down to zero, but have been able to get it down very low again. Okay,
so but what are you looking for to go down to level 3 or level 2 for people to get back out of their homes and into the workplace? What do we need to see numbers-wise?
Well, we've said in the first case that, of course, it's going to take a 4-week period to start with. And what we are starting to work on now is what are the criteria? What are not just the numbers, but what's the nature of the transmission? If we've still got isolated outbreaks that we can manage quite easily, then that may allow us to go down to level 3. If we're still seeing new cases popping up around the place, then that would give us a sense that we may need to stay in level 4 somewhat longer.
Okay. Is it a notifiable disease?
Yes, very much a notifiable disease. It was made a notifiable disease very early on.
The reason I ask that question is in Britain, because it's notifiable, this is what people die of, but they may not have died of that. Is that a wise way of measuring all of this?
Well, what other countries have found is that some people die with COVID-19. They say they die with it rather than of it.
Correct.
But in this instance, because it's a new disease, we want to know of any people that die and have COVID-19 infection. That may not be the primary cause of their death, but it is important for us to know just how many deaths it is contributing.
But isn't that the danger of reporting it the way we are? The poor woman who died yesterday, I mean, what we know from around the world is virtually everyone who dies of it has underlying health issues. Therefore, was it the underlying health issues or was it the COVID? In other words, how deadly is this? And if you're going to call every death a COVID death, that makes it sound more deadly than it really is.
Well, the first point here, Mike, is it's not just older people and people with pre-existing conditions. Yes,
generally speaking, it is.
They are more likely to die. However, it can affect, other people. Even young people can die from this. So that's important. But the other point you make is a good one. People with pre-existing conditions and older people, it tends to be if they get an infection like this or even influenza or some other infections, because they have less ability to fight it off, then they tend to get the complications that then lead to death. So it's a contributing factor, and it's an important contributing factor.
Do you know the name Jean-Dominique Michel?
I don't know that name.
Right, so he's one of the top infectious disease experts in the world. He wrote a very good piece you should read, and one of the things he observes in it is, for a start, what we're doing is Napoleonic. In other words, what you do is test the people with it, not the people without it, and don't lock people up. But what he also points out is if we ran tallies and boards for any number of diseases on any given day, anywhere in the world, we would be freaking the population out the way we are with COVID. In other words, for Germany, for example, there are 2,600 people who die every single day of respiratory-type diseases. Every single day. We don't run boards, we don't close borders, we don't land airlines. Why are we doing it with this?
Because the difference here, Mike, and I think people understand this is an entirely new disease. The human population in the world has not been exposed to it before. We have seen it go in 2 months from 300 cases to over 500,000 around the globe, and we still don't know what the trajectory is. We have seen many people get infected and die from it. We have seen it spread globally very rapidly. We need to take a precautionary approach here. He's right in his point, but this is a novel disease, and I'm sure even that specialist would identify there is a difference between existing infectious diseases and novel ones like this.
Has the messaging been a frustration to you? How far do we go for a kayak, a mountain climb, down to the beach, into the neighbourhood, out of the neighbourhood, in the bubble, out of the bubble?
Well, the messaging hasn't been frustrating for me. We're in a novel situation here. It's extraordinary times. We have to just, in a sense, apply common sense to each situation. So, look, I think most people understand that it's just a matter of applying very good judgment, and many, many people are doing that.